Now let me get into the organization of nonprofit community hospital. Well, for nonprofit community hospitals, they serve as, in most cases, as multi-purpose institutions, right? Because they include satellite outpatient clinics, affiliated group practices, also smaller hospitals. Right? They also include management organizations providing administrative services to physicians. Okay? And these hospitals employ primary care doctors as part of their physician network. And so here is a organizational chart of nonprofit community hospital. And here, what I'm trying to get into is the due authority structure, right? So here we have governing body of nonprofit community hospital, right? Usually comprised of, board of trustees. Under that governing body, we have two major, you can call them, administrators. One is administrators in charge of non-medical part of administration. Then we also have medical director, okay, an expert professional in charge of medical expertise. And under medical director, we have chief of medical staff. So under this branch, we have professionals, medical professionals that have expertise in healthcare treatment. Well, under administrators, we have, for example, director of nursing, chief dietitian, assistant administrator management, and assistant administrator services. And they are comprised of professionals specialized in the administration of hospitals, how to run the hospital, not necessarily that they have medical expertise. Part of that they do, but they're not considered to be the top echelon of medical professionals, like nurses, right? Dietitians, they are considered to be the supporting staff of medical doctors, right? So let me get into the due authority structure of hospital. Also for hospital, here we're talking about nonprofit community hospital, usually supervised by a governing body, board of trustees. And most of them don't have any medical experience or expertise. Used to be, this body had most power in, management of hospital because they brought in funding to run the hospital, right? Especially in 19th century and early 20th century. But there was a shift in the power structure from these non-experts, powerful people, to medical doctors. So in a contemporary hospital, nonprofit community hospital, there exists a due system authority comprised of administrative authority and medical authority. And the system emerged, hospital, emerged as a trustee control of hospitals, gave way to medical dominance. The medical profession was balanced same time, over time after the medical dominance. If you remember, that's 1950s, 1960s. That's the peak golden age for medical doctors. Was balanced by the growing influence of the hospital administrators who served to place checks on the medical exercise of power, because a couple of scandals, during the peak time of, doctoring, etc., because of, too much power on the side of doctors. So the hospital has become an organization consisting of varied group of professionals and allied health workers with different functions, training, and occupational values. So the effective functioning needed a decentralized system authority organized around a central objective of service to the patient. So how to do that? Well, administrators here, we're talking about administrators in charge of bureaucracy, daily running of hospital, direct and supervise hospital policy, whereas medical staff retains control over medical decisions. The system can cause stress, inconsistency, overlapping of responsibilities, and inadequate coordination because of varied, right? Varied health professionals, groups involved in this whole process. Right? But also results in the process of negotiation that results in efficient and standardized forms of behavior, not dependent on special instructions for all situations. Right?